Hi, I'm Dr. Lord. I'm an ophthalmologist in St. George, Utah, and today I'm going to talk to you about cataract surgery. So the first question is, what is a cataract? This is a model of the eye, and here's the front of the eye. Okay, here's the cross-section through the iris, which is the colored part of the eye. The small hole in the center is called the pupil. That's a window to the back of the eye. Right behind that iris is this structure we call the lens. Okay, and that's what does a lot of the focusing of light as it enters from the outside world, goes through the cornea, through the iris and the pupil, and through the lens and hits the back of the eye called the retina. The retina is kind of the image processing center, but the focusing center happens in the front of the eye. And what can happen as we age is that lens can become cloudy. And there are a lot of different types of cataracts, but they're all kind of classified as a cataract because they all obstruct light or impede light as it travels from the outside world to the back of the eye. What causes cataracts? Well, the number one cause is age. As we age, this lens gets a little cloudy. There are some medicines and some medical problems like diabetes and some inherited conditions that can cause cataracts, but for the most part, age is the number one risk factor. And we often get the question, are cataracts only found in older people? And no, you can be born with congenital cataracts. You can get cataracts from trauma to the eye. But most of the time, when we reach about 50 to 60, we have developed somewhat of a cataract. The lens has become a little less elastic, and that's a condition we call presbyopia, where we lose our ability to see things up close. And oftentimes, we will operate on a patient and to replace that cloudy lens and put a new clear lens, an artificial lens in its place to help that light in its passage back to the retina. How fast can cataracts develop? Well, they can happen very rapidly in the case of trauma, or in most cases, they're pretty gradual. And cataract surgery is not an emergency. It's usually you reach a point with your doctor that you decide that you would like to proceed with cataract surgery. If it's affecting your daily living, if you're unable to write checks, if you're unable to eat your food or cook your food, then you're probably a great candidate to have cataract surgery. So they don't necessarily have to happen rapidly, but they can happen rapidly, or they can take years to develop and get more severe. What are the symptoms of cataracts? Well, patients that usually have an inability to see things up close, that's common. And sometimes if the cataract gets bad enough, they can have an introduction of a new ability to see up close, because that cataract can give them better near vision in what we call induced myopia or induced nearsightedness. Sometimes that cataract gets cloudy and we're able to see things up close that we weren't able to see before. But oftentimes the symptoms are a graying to your vision. You're just not able to see the letters. You're just not able to see the street signs like you were. And or sometimes if they're really severe, you can't see. You can see very little, maybe even just light in front of that eye because the cataract is so bad. Who's at risk for cataracts? Well, anybody over 60 is going to have some form of a cataract, some degree. People that have diabetes or are on certain medicines like prednisone or any steroids or inherited conditions, they're all at risk for developing cataracts. How common? Everybody over 50 or 55 has some degree of a clouding of their lens, and we term that a cataract. It's pretty rare nowadays that you reach 80, 90 that someone hasn't talked to you and told you that have a cataract. Now, you don't have to have cataract surgery at 80 or 90 years old, but oftentimes cataract improves vision, and if we can allow more light, even if they have retinal conditions like macular degeneration or diabetic retinopathy, if we can allow more light to enter the eye, patients typically see better. What can be done to prevent cataracts? Well, if you have diabetes or you're on steroids, you want to keep those well controlled. You can try to get younger, but that doesn't always work so well. Most patients reach a certain point where cataracts develop. We think that UV light plays or has a role in cataract development. So as a young person, if you wear sunglasses that are polarized and can block UV radiation, that is helpful. Will it fix itself? Oftentimes patients want to know, is there anything I can do besides surgery? And the answer is typically no. Cataracts will not reverse. They don't get better on their own. The number one treatment, and it's probably the number one treatment surgery performed in medicine, is cataract surgery. And without treatment, the condition will typically get worse. You will have a progressive loss of vision in the affected eye. So can vision loss be repaired if it's already occurred? So if you're already seeing poorly from your cataract, can it be fixed? Absolutely. We can go in with tiny instruments. I'll talk about surgery in just a moment. Tiny instruments and take out that cloudy lens and put a new lens in their place and restore vision and help light to become unimpeded, reaching the back of the eye. When is it serious? Well, when you're not typically passing your driving exam, that's usually the time that you need to go and proceed and get surgery done. Can total blindness occur from cataracts? It can. Now, can a patient get to the point where they see no light? That's uncommon. Cataracts usually don't limit all the light from entering the eye. But you can be walking into doorway or door jams and tripping over objects on the floor from even a moderate cataract. So when we've reached the point where very little light is entering the eye, that's a little late. We like to catch cataracts and treat them well before that occurs. How emergent is treatment? It's really not emergent. A cataract is an elective surgery. You can have the surgery today or next month or next year. It's usually the same. It really depends on how bad a vision the patient is experiencing and how many symptoms or how bad it's affecting their activities of daily living. How do we diagnose cataracts? Well, every ophthalmologist in their office has a slit lamp. We dilate the pupil, we open up that window to the eye, and we have a great view of the cataract. If the cataract is very dense, we can do an ultrasound into the back of the eye to see if there's any pathology in the back of the eye, but just a simple slit lamp, normal ophthalmologic or optometric exam can diagnose a cataract. What treatments exist? Well, nowadays we've become very sophisticated for treating cataracts, and there is no other option besides surgery for cataracts. We will take a patient to the operating room and we will make tiny incisions into the clear part of the eye called the cornea, and we'll use an instrument called a phacoemulsification, a phaco cutter, and we will take out that cataract, we'll leave the capsule intact, and then we'll put a clear artificial lens in its place. What's the success rate of this surgery? It's 99.9% successful. Sometimes there's a little tear in the back of the capsule, and vitreous that's normally housed in this back posterior cavity, or this vitreous cavity, will come forward and will compromise the surgery somewhat. But even then, we're pretty good at getting a lens into that space and tethering it in place through a variety of means, and patients can have pretty good vision even if some of the minor complications exist. Now, the other complications that can occur are common to any ophthalmic procedure: bleeding, infection, damage to the eye, need for a second or third surgery. Pretty rare. Most of the time, we're pretty good at going in, making a small incision into the top of that capsule, cleaning out the cataract, and putting a cataract or a clear artificial lens back in its place. How much vision are you going to regain? You're probably going to get to your childhood vision, or at least as much vision as is possible given your eye. And if you have any macular pathology, that might limit your overall vision, or your retinal pathology. Can you travel after surgery? Absolutely. Most patients don't have any major complications after a surgery like this. You usually can be back to mild to moderate activity within a few days after surgery. And patients can do quite well. We don't want patients playing soccer or going kickboxing after cataract surgery, but for the most part, you can be up and at them within a few days. There are a lot of options when it comes to cataract surgery. And when I say options, I mean choices that you can put inside the eye for these lenses that we have. They can correct any astigmatism. Astigmatism is when the shape of the cornea is irregular. It's more football shaped than spherical, like a basketball. There's lenses that will correct for astigmatism. There's new lenses that we call premium lenses. They're multifocal, and there's even another type of lens called an extended depth of focus lenses. A lot of options that patients have for cataract surgery. Some of them are covered by your insurance, some of them are not. But for the most part, every patient, when they are ready to have cataract surgery, they have many options for correcting not only their cataract, but also correcting their astigmatism, correcting their presbyopia, their ability to see things up close. We hope that every patient knows about these options and can make educated decisions when they're ready for cataract surgery. Thanks for watching our video.